According to the CDC, more than 1/3 of adults in the U.S. are obese. People on the SNAP program are twice as likely to become obese than people off the SNAP program. SNAP is a program in the U.S. that allows a monthly monetary allowance to low-income families. For a family of 4, you have to have a monthly gross income of around $2,600. For a single person, that's around $1,200. Another eligibility regulation is that you must either have a job or be actively working for a job. You cannot reduce any hours while on the SNAP benefits, and you cannot turn down any job opportunities while receiving SNAP benefits. The current SNAP program should change to limit junk food consumption, which over time will lead to a decrease in obesity in the U.S. There are many opposing arguments to this, to limiting junk food consumption for the SNAP program, including First Amendment rights, why junk food is less expensive than healthier food, and moral factors. The first argument is the First Amendment. The First Amendment is the freedom of religion, speech, and expression. With the freedom of expression, many people believe that if the government were to limit junk food consumption on the SNAP program, people wouldn't be able to choose whether or not they want to eat healthy or unhealthy foods. A Texas representative, Elliot Neistat, says concerning limiting junk food for SNAP program members, saying, "I think we need to respect the choices they make and allow them to have flexibility in what they purchase." He's basically reinstating the freedom of expression clause in the First Amendment, saying that even though we make unhealthy choices in our everyday, we shouldn't be able to limit what they do, and that they should have the ability to purchase whatever they want with their money. The second argument is that junk food is less expensive and more readily available to the general public. While this is true, there are many things that the federal government can do to make healthier foods less expensive and more readily available to the general public. Tatiana Andreeva, a researcher with Rudd Center for Food Policy and Obesity at the University of Connecticut, said it's hard to eat healthy on a very limited budget. The people on the SNAP program receive about $134 estimated average monthly benefit for a single person, which is around $460 for a family of 4. Research has found that at the start of the month, many families eat healthier, but at the end of the month, they choose more higher calorie, higher fat foods that will last them a longer time until they get benefits. Another study shows that people on SNAP are less likely to eat 3 meals a day. People believe that if the government were to limit junk food from the SNAP program, that people would be less likely to eat even 1 or 2 meals a day. The last argument is the moral factors. Many people believe that if the government were to limit how people act, then they would be controlling too many actions of the general public. Social Services Director Philip Browning says there are calorie counters on menus now concerning fast food restaurants, so many people can make informed choices. The problem is many of us don't. He's basically stating that why should we hold any SNAP program members to a higher standard where they should eat healthier choices and live healthier lifestyles than many of us that don't eat healthier lifestyles and dine at fast food restaurants very regularly. While many of these arguments have valid points, including how junk food is less expensive and more readily available to the public, there are many problems that allowing junk food on the SNAP program has to the U.S. and their obesity crisis. The first problem is the state's monetary cost. According to the Texas State Comptroller's Office, obesity conditions cost Texas businesses up to $9.5 billion a year. Obesity conditions such as high blood pressure and high cholesterol can lead to lost worker productivity when workers have to leave the job to go to a hospital visit or to regular doctor's appointments. And it can also lead to increase in insurance rates. Eric Finkelstein, an economist and professor at Duke University, found that obesity-related conditions were responsible for almost $86 billion in medical costs, and that there's an 86% increase in medical spending for obese people. There's been a link between obesity and lower income, and this may be due to the fact that more obese people will have to pay more money for their health benefits and for the life-saving medicine that they have to deal with these diseases. Another problem is the increase in health risks. The CDC found that obesity leads to heart disease, stroke, some types of cancer, and type 2 diabetes. The American Cancer Society found that people on the SNAP are more likely to drink sugary beverages than people off the SNAP program. Because these sugary beverages lead to these obesity conditions, including the heart disease and the diabetes, it can also debilitate them and keep them from taking on jobs. People in the SNAP program have a lower job stability, which means that they may go months without having an income for their family to buy food and to buy clothing and to buy necessary bills and other costs such as that. If they have other diseases that debilitate them from getting jobs, they won't have as easy of a time finding jobs with their diseases because they have to spend more money on medicines and hospital visits. The third problem is the lack of public health education. While many children know about the My Daily Plate and recommended food diets in school, many adults don't recognize or don't even know about food nutrition and just opt for putting food on the table to feed their children. One way to prevent this is that healthcare providers and health insurance companies can teach families and children on how to get healthy exercise and how to eat healthy to make sure that they're living a healthier lifestyle. Another way to help is to decrease the cost of healthier foods in the US. One way to do this would be to tax junk food. Two countries that have taxed junk food are Mexico and Hungary. Mexico taxed junk food based on its caloric intake, so an increase in calories was taxed more than calories that were decreased in some food items. Hungary focused on food items with an increase in sugar and sodium intake that would go over the daily recommended rate. Both of these countries found that there was a decrease in consumption over time, and the World Health Organization says that Hungary brought in about $219 million $19 million US dollars for public health spending, and it also helped them decrease healthier foods. If the US were to reinvent this tax on junk food, they could also use this money to decrease the costs of healthier foods and use it for public health education. In conclusion, I talked to you today about the reasons why we should limit junk food on the SNAP program in the US and why there are arguments against it. For the opposing side, they believe that the government shouldn't decide what people can or cannot eat on the SNAP based on First Amendment rights and the freedom of expression, monetary benefits, and why junk food is less expensive than healthier food, and moral factors, and why the government shouldn't decide how people should live. My view is that in the increase in healthcare costs and health risks, and the lack of public health education in the U.S. is a direct effect of the junk food allowance on the SNAP program. Limiting junk food for SNAP would decrease levels of obesity in the U.S.